Live from the Washington, D.C. area, it's the Inside Scoop. All the news that our viewers want to know. Now, here's the host.
How's everybody on our viewer screen? This is Ken McMillon, and I'm the host of Inside Scoop, and I have a very special guest today. His name is Jay Brock. He's very well versed in Medicare for All, and I want to welcome him. Good morning, Jay. How are you?
Good morning. How are you?
I'm doing fine. You want to tell us a little bit about yourself?
Sure. I'm a retired family doctor. I went to medical school at McGill University in Montreal, Canada, at the time when they transitioned to a single payer system. I did all my medical training at McGill. When I finished my 4 years of medical school, I did an internship and residency in family practice at McGill. They asked me to stay on and teach the same residency training program, which I did do for the next 6 years. I was a full-time member of the McGill Faculty of Medicine, and I attained the rank of assistant professor full-time of family medicine at McGill. Then I moved back to the United States and set up a solo practice in Virginia. I'm a past president of our local medical society, involved quite a bit in state medical politics over the years. And when I retired just before the Trump election, I decided that if they were going to get rid of Obamacare, I need to know a little bit more about how insurance worked from a street level, and decided that after looking at health insurance here in America, where I'm from, and in Canada, where I trained, that the Canadian system is to be desired. Let me just add before we go on, it's sort of funny that even opponents of Medicare for All acknowledge that the Canadian medical system of insurance is more popular in Canada than hockey is, while here, of course, we acknowledge that our American health insurance industry is about as popular as the telemarketing industry.
Interesting. So give me a little explanation about what is Medicare for All. What does that mean, so people can wrap their heads around it, so to speak?
Sure. There's lots of different names for it. Some people call it National Improved Medicare for All because it's not exactly Medicare. I like to call it a single payer Medicare for everyone. And what it is a single government entity, if you want to use that word, an entity. It's an insurer that collects all of our bills and pays all of our bills. It's a single payer. Right now, what we have is a system of multiple payers. When you look at all the insurance companies and all the different plans, there are thousands of payers out there, each with their own rules and regulations. It's an extremely unwieldy system. It's extremely expensive to run. You've got Medicare, you've got Medicaid, you've got Blue Cross, you've got Aetna, you've got United Healthcare, you've got Kaiser, you've got hundreds and hundreds of others, each with their own rules and regulations. And as opposed to some opponents who say that a one-size-fits-all is not workable, the one-size-fits-all single-payer Medicare for All actually is extremely workable. I've seen how successful it can be in Canada, exceptionally so, especially compared to our current system. And part of the problem with our current system is that it is so expensive to run. Here are a couple of figures. It costs, according to a recent study in the Annals of Internal Medicine, a very prestigious American medical journal, compared to what we would spend on our healthcare system, if we had a single payer and what we have right now, we waste $600 billion a year simply in administrative costs to run our current system. That's $600 billion more that go into building a bigger medical bureaucracy, not towards patient health care, than if we had a single payer system. That's one of the reasons why, as America, we pay more than everybody else and get less for it. And we can talk about the exact numbers a little bit later on. It's staggering the kind of waste we have in the system, given the fact that we don't cover so many people.
That's interesting because a couple of years ago, a board that I sit on I go out into the street and I ask people, where are they going to get their health care, to get certain things from. And quite a few of my friends who are immigrants to this country come from other countries. One of the guys who actually owned a deli in the apartment complex where I live, he's no longer there. He sold his business earlier last year. But he went back to Korea to get some health work done. And when I brought it up before my board members, they said that the cost of him going to his country and coming back, would be, it's very expensive. And I said, actually, no, it's not. And then they said, well, the doctors that are there are actually more inferior than the doctors that we have here. And I said, well, I've done my research because I kind of knew where you were going to go with that. I said, I found out that the doctors there were trained by our American doctors here. So you can't have that argument, and you're 3-0 right now, And so, so can you give us a reason why, what is the role, first of all, of good health insurance system?
Well, there are two things that a good health insurance system should be able to do. Number one, it should be able to cover everyone. That's a given. And number two, it should be able to do it affordably. Our current health insurance system has failed to do both things. And there are a lot of reasons why. Part of that is based on the free market. We can talk about that a little bit later on. But I don't think that our system will ever do that. And when you look at the benefits of a single payer system, which really is single payer, when you go to the doctor, you don't pay a copay. There are no deductibles. You have no out-of-pocket costs, essentially. And we have so much waste in our system. The $600 billion is only start of it. There's even more than that. That if you had a single payer system compared to what we have right now, there's so much money already in the system that people can go to the doctor with what's called first dollar coverage. No money out of your pocket. Now, some people like to call that free medical care. I call that affordable medical care. And it should be the same for everybody, because I can tell you, running my own practice, if I had to collect even a $5 copay, that's an expense. I have to have somebody that I hire, that part of their job responsibility is to make sure that that $5 is properly tracked, and that's expensive cost to me. And when you look at what hospitals have to do, there's the average cost of administering a hospital for billing is about 25%. That's twice as much here as it is in Canada. There's an average of about one biller per hospital bed in America, which is a huge economic waste. So part of the problem with being able to afford to cover everyone is all the extra costs we have in our current system. And because of those extra costs, there's not enough money to cover everyone. So our system doesn't cover everyone, does not do it affordably. What we do is we leave about 30 million people on a good day without any health insurance at all, and probably 50 million people who have insurance but can't afford to use their insurance. They're called underinsured people. 50 million people. What good is insurance in America that you cannot afford to use? So those are the two things that any good insurance system should be able to do. Cover everyone, do it affordably, and that's why we're not doing it here.
So based on what you just told me, is it safe to assume that there are some people who need some sort of health care, and because they can't afford it, they go without it? And if they are doing that, especially when it comes to life-threatening situations, such as you may need a new kidney or something like that, wouldn't that be a greater toll on the system, not just the individual, but in the system itself for all people, all Americans?
Exactly right. Exactly right. So I think Ben Franklin said an ounce of prevention is worth a pound of cure, and a pound was $1 back then. So that's exactly right. What ends up happening is that is illustrated by the following study that came in the Lancet about a year ago. The Lancet is, to me, one of the world's most prestigious medical journals. It had a study that came out of Yale University, School of Public Health, and other University of Maryland, I think University of Florida. And it's a landmark study for me. And it showed that if we had a single payer system, we would cover everyone. and it would save $450 billion to give everybody medical health care. And it would also save, get this, 68,000 lives, just looking at people who had no insurance, okay? Not even counting the people who can't afford to use insurance. So it's in the tens of thousands of lives a year, people who can't afford to go to the doctor, either because they have insurance they can't afford to use, or because they have no insurance and can't afford to go to the doctor. 68,000 people die every year as a minimum, according to this study, just because they have to delay timely medical care. And of course, if you delay timely medical care, now you've gone from a easily solvable problem to one that is insoluble, and then you've really escalated the costs. 20% of the people account for 80% of the cost in our system. We could cut a lot of that down if we gave them timely medical care and would delay complicated, very expensive medical care as a result. Good question.
So then what is the purpose of health insurance? I mean, the role of the company should be an insurance that we are guaranteed to get something back for the dollars that we put in. But from what you're saying, that's not happening. So what is the purpose? Why do we even have them?
That's a very good question. Basically, why do we buy insurance? We buy insurance for those unexpected expenses that are either completely unaffordable or that are onerous for us to afford. So we spread the risk, okay? So let's look at our current system from 30,000 feet. Insurance is all about risk. It's like gambling. Gambling is all about the risk, and so is insurance. And in gambling, you set up your system, your house, so that the house always wins. That's the whole purpose. You start up a business, you're a gambler, and you want to make sure that the house always wins. So if the house is there the next day. We have the same system here in America, but it's a problem. The house in America always wins. And of course, the house is the insurance company, the health insurance industry. The problem with that is that it creates the following business model. In America, when the house has to win all the time, the insurance company's business model is to take as many of your healthcare dollars and mine, and then spend as few of them on your healthcare and mine as it can possibly get away with. That's the classic definition of a middleman. Basically who gives you very little or nothing back in terms of service or production. So all the money that the insurance company takes out of the system is something that isn't therefore able to be used for anybody's healthcare anymore. And here's the amount of money that it essentially is taken out, not just by the insurance company, but to run the entire system. We talked about $600 billion of administrative costs alone that are wasted. That's over and above what we would be spending on a single payer system. But when you add in, on top of the administrative costs, you add in marketing costs, overhead, and profit, it's probably easy to say you can add another $150 billion. So we had the 600 and the 150. Now you're talking about real money. You're talking about $750 billion a year. That's $3 trillion every 2 years. That's wasted in essentially building a bigger medical bureaucracy, money that should be used, that's already in the system, that should be used on your healthcare and mine, that instead goes to feeding the bureaucracy. And then as a result, we have not only 68,000 people as kind of as a minimum who die every year, but we have people who go medically bankrupt. There are about 500,000 medical bankruptcies every year in the United States of America. What's a medical bankruptcy? You can't afford to pay exorbitant medical bills. And the money that you as a family have been setting aside, maybe to help the kids in college or to help them through a hard time or to save for a vehicle or a vacation or your own retirement, all that money is gone to pay exorbitant medical bills. And it happens 500,000 times every year. We are an outlier amongst the world's other advanced nations. We are the only nation that doesn't give universal medical care that's affordable. We're the only nation with staggering amounts of death as a result, medical bankruptcies, and unaffordable costs that leave too many people out of the system. So we pay more, almost twice as much as the combined average of the world's other nations. We get worse results. We don't live as long, and we have worse child and infant mortality. So I think that's an outrage in the wealthiest country of the world that our statistics are so far behind everybody else. Great question.
That's a mouthful because we are at one time was listed at one of the most developed countries in the entire world. And basically, what you're telling me is that we are so dysfunctional, at least in part for healthcare, that we have lost any credibility that we would have in being that developed. But my question now is, you're a doctor, you're a physician, correct?
Yes.
So how come other physicians have not squawked and said anything about it like you have? What is holding them back from doing that and buying into this? It would seem to me that they would be very supportive of getting an effective healthcare system in here where the patient comes first. In other words, there is an oath that you all take, doctor, do no harm.
Right.
They're not holding up to that decree.
Well, I think part of the problem is that we're dealing with perception in politics, and a lot of that depends upon the money. The loudest voices here are the insurance industry and pharmaceutical industry and other healthcare industries, which find that single payer would be a threat to them because a different system would put the patient's interest first, not the interests of the various industries. But there are actually widespread support amongst physicians for a single payer. The General Organization of Internists, the largest organization in America of a single group of physicians, came out in support of Medicare for all. It's gratifying to see from my point of view that we've gone from a minority to a plurality and now a majority of physicians. The last figure that I seen was 59% of physicians support Medicare for all. There's a group out there called Physicians for a National Health Program. You may want to look it up, but your viewers, pnhp.org, Physicians for National Health Program. I'm a member. And there are 20,000 plus strong physicians who are out there as members who are pushing for a single payer. That goes along, by the way, the increasing support for Medicare for all is there also. The latest poll that was mentioned in Newsweek magazine sometime last year, more than 70% of the country is in favor of single payer. 88% of Democrats, 51% of Republicans, the majority of independents are for. Now, we can talk about the public option that gets some support too. I will introduce the topic now by saying you don't want to keep the current system because of all the expenses. The public option or building on Obamacare may sound good, but it just perpetuates all the waste that we have right now. If you want to ask me about that later, feel free.
You know, and while we're on that specific name, me being a person of color, I've always thought that calling healthcare Obamacare was really racist in and of itself. And the reason why I said that is because before that, it was healthcare or Medicare. And as soon as Obama was able to do something good by getting that done during his legacy, they used it as a tool to make it a negative term, Obamacare. And you know, I used to hear people from when I worked for a major company, I won't mention their name, they were really all over that with all these jokes and stuff like that about President Obama. But you know, when we talk about this, and we've just described why it's so dysfunctional and so broken, why isn't the free market working? What about choice? You know, what do they bring? What does those things bring to the table?
Well, I think at the time, and I was a big supporter of Obamacare when it first came out, I wrote an op-ed in my local newspaper showing that how popular it was amongst a lot of people, even though maybe Republicans were against it. I thought it was a wonderful advance. But the problem is that Obamacare, for all of its strengths, is built on our current system. It's got all the built-in problems, the huge out-of-pocket costs, the fact that the insurance company with its networks that tell you which doctor you must use, so there's no choice there. and the costs involved really didn't help very much. And I think we need to go large. That's why I'm all in for Medicare for all. And I also think that the insurance industry had the opportunity to take Obamacare and to use it to help extend health insurance that would be truly affordable to a lot more people. Instead, in my view, what the insurance industry did was used Obamacare as a cash cow, as the golden cow. And I think they killed their golden cow, their golden goose. So right now, my feeling is that as good as Obamacare was, it's not as good as because I think its possibilities are ruined by the health insurance industry. I think we need something to replace it. So there's two things about the free market. And you mentioned choice. We can mention the other thing, which is cost and affordability. When it comes to choice, and I know that opponents, especially Republicans, love to talk about how it takes away a choice, and nothing could be further from the truth. Choice is really important in a free market, but there are several things that the opponents don't tell you. First of all, there's a whole lot more choice with a one-size-fits-all program, because the choice that really counts is the choice that you have as a patient of seeing the provider that you want to see. Going to the doctor, the hospital, the x-ray, the lab, the physiotherapy, the occupational therapy, the nursing home, whatever. You want to be able to go where you feel that you fit in most, okay? The current system doesn't allow that. The insurance company will dictate to you, this is a list, choose from this list. It's usually limited, okay? So that's one choice that you don't have. The insurance company wants to give you a choice of which crummy policy to use. Do you want policy A, which is too expensive, or policy B, which is too expensive? Well, policy C seems, let's say, it's not as expensive, but if you get sick, it's not going to do anything for you, so it's really expensive. So there's really, the choice is a false choice that opponents will talk to you about. The final thing is, when it comes to choice in healthcare, when I go and buy a dishwasher, I go to the store and I look at this brand or that brand. And, I look at the labels, how much it's going to cost me, what this is going to do, what that's going to do. And I can choose based on what's good for me, what I can afford. I can choose this product versus that product. When you're a patient and you get sick and you think that you need some health care, you don't do that. You don't go to the healthcare store and pick out from that shelf a particular service, from this corner of the store a particular product. You go to somebody like me, who figures out what you need to get better. So I pick out the service that you need, and I pick out the product that you need. And, even if you know what the cost is, what do you do when you feel sick, or if it's your kid who's sick? You're going to say, no, I don't want to pay that. I want to pay less. There's one pace, whether it's opaque or whether it's transparent. There's only one price. And usually when you're sick, you don't have enough time to shop around and find out who's cheaper, who can give you the best price. You're going to go to who you're comfortable with, and you're going to be told this is what you need. And your choice is to either say yes or no. Yes, I want it, or no, I don't want it. And in healthcare, that's really the only choice that you have under the current system and under any system. But I want people to have the choice of the provider that they want, whether it's an insurance company, green shade telling you this is the hospital you must go to or the doctor you must use. So that's choice.
So,
if you want to talk more about the free system, I can talk a little bit about
well,
how it's not set up for healthcare.
We're going to get to that in the second segment. Can you give me a quick answer on, can we afford Medicare for all?
Absolutely. We already put enough money into the system to more than pay for it and get $500 billion or more back. Okay, we just don't spend that money wisely. We spend that money on basically waste, the administrative cost, and stupendous pharmaceutical cost. So yes, absolutely, we can afford it.
When you talk about that, are you including things like an EpiPen that should be the cheapest form of helping someone who has an allergy out, that they just blew up the price and ballooned it so that it's almost out of reach for most people who have allergies and things of that nature? Is that what you mean?
Exactly right. When you have a system that's geared to putting the patient's interest first, you don't allow for a EpiPen company to come along and say, we're going to charge something that should have been $20, maybe, I'm just taking a guess, and charge you $1,200 for it. That is only the benefit of the company that manufactures it and its shareholders. It's certainly not for the good of the patient.
Absolutely. Um, just before we take a break here, I want to bring up something, and I'm not going to call any names, but we just lost a candidate that Biden, our president, wanted to have appointed to a certain position, and one of our allegedly people spoke out against that. And unfortunately, nobody really knows the science behind that, but I do, because his daughter works for a company that has the EpiPen and ballooned it up. And this person that was trying to get appointed, on his cabinet, has spoke out about that. And so this was tit for tat. You attack my daughter, so I'm going to attack you and deny you position. So this is how we have little situations like that, where people break the party line. Instead of doing what's right for the people, they would hold a grudge against one person just because of a family insult, as the way they took it. But we're going to take a break right now. And when we come back, we have a whole boatload of other questions that I want to put into your wheel well. Okay?
I work out every day. COVID won't kill me.
I'm 24. COVID won't kill me.
I have antibodies. COVID won't kill me.
It's been a long week. COVID won't kill me.
I'm 25. COVID won't kill me.
I'm partying outside. COVID won't kill me.
I don't need to wear a mask around my friends. COVID won't kill me.
I'm 23. COVID won't kill me.
If I haven't gotten it yet, COVID won't kill me.
I'm young. COVID won't kill me.
Famous last words. Don't let them be yours. Socially distance. Mask up, America.
What's it feel like when a woman's having a heart attack? Chest pain, like there's a ton of weight on your chest. Severe shortness of breath. Unexplained nausea. Cold sweats. There's an unusual tiredness and fatigue. There's unfamiliar dizziness or lightheadedness. Unusual pain in your back, neck, jaw, one or both arms, even your upper stomach are signs you're having a heart attack. Don't make excuses. Make the call to 911 immediately. Learn more at womenshealth.gov/heartattack.
Freedom. It's at the core of who we are. The freedom to live without fear, to jog where we please, to wear a hoodie. The freedom to breathe. Before we celebrate the freedom most Americans have, we must fight for the freedom all Americans deserve. Because all lives can't matter until Black lives matter.
Our fight against coronavirus isn't over. Let's wear face masks in public. Stay 6 feet or more from others. Follow state and local guidelines. And wash our hands frequently. Let's move forward together. Learn more at coronavirus.gov.
We're back to the Inside Scoop. Here again, your host.
Hello, everybody. Welcome back to Inside Scoop. My name is Ken McMillon. I'm today's host. And my guest here is Jay Brock. He's a physician. He actually has a physician's license, and he's practiced medicine for quite some time. But he's the expert that I chose for Medicare for All. Hello, Jay. Welcome back.
Hi, Ken.
So we're going to pick up where we left off at the last thing, and I want to ask you a very unique question, and I'm hoping that you have an answer for this. So why isn't the free market working?
Yeah, the free market is good for a lot of things, but maybe not so much for medical care. Why is that? Well, in the free market, nothing is free. You can only buy the product or service that you can afford to pay for. Maybe a better way to handle medical care is to be able to get the product or service that you need to get better. That's the whole idea about having insurance, by the way, so that you can afford it. Everybody should pay what they can afford to pay, which of course is one of the major benefits of single payer Medicare for all. Why change the current system? Why are so many of us pushing so hard for a single payer? And the whole thing is to make healthcare truly affordable. And one reason why how it does that is that your contributions towards Medicare for all are based on your income. It's not only very fair, it's the most affordable way that I know how to make Medicare for all available to everybody.
Interesting. Can we afford Medicare for all?
Again, absolutely we can, because again, we put more than enough money than we need to cover everybody into healthcare already. Studies have shown anywhere from, depends upon who does the study and how they work out the parameters ahead of time. But the figure that makes the most sense to me is about $500 billion a year is what we waste in healthcare compared to what we spend. If you, so we already put enough money for Medicare for all. We just don't spend that money wisely. As a matter of fact, we waste a good $500 billion of that. That $500 billion can do a whole lot more good rather than pushing paper around in the health insurance or other industries.
So basically what you're saying is we don't get our bang for our buck,
right?
So to speak. Or another way of saying that we don't get a return on our investment. We're investing a lot of dollars into it, but the people who need it the most are not receiving the care that they need. And, you know, do you have something, is that radical, or am I thinking obscure? What say you?
Well, clearly what we have is a system where it could be characterized in a two-word phrase that I grew up with, a ripoff. You're paying more and getting less. And that to me is a definition of a ripoff. I think that's radical. I think we are the radical outliers. When you look at the 30, 40, 50, 60 other advanced nations out there, however you want to define them, we're the only one that doesn't have universal, affordable health care. Now, they do it in different ways. I just personally think that Medicare for all as a single payer is clearly the best way to get it done, especially given the history we have of a health insurance industry that really has shown over and over again it's willing to put its interests first compared to the patient. But the radical plan is our plan. We're the outliers. A Medicare for all plan is not the outlier. It would allow us to join the rest of the other industrialized nations of the world and get everybody healthcare that is affordable, healthcare that is universal. That's not radical.
Before I go to another question, I'm going to speak of, we're in the midst of a pandemic. And I got to say, and I'm not going to go into the political arena, so to speak, but did we do enough? Because we've heard this over the news, that we have now had over 500,000 people who have lost their lives. And I got to tell you, that breaks my heart. That breaks my heart because from my point of view, I see it as something that didn't have to happen. Surely we were going to lose some lives, but to lose 500,000 people, it's unfathomable. And what do you say about that? Not being political, but how would healthcare or Medicare for all, shouldn't people on the medical side have stepped up and said something about what they see as first responders into this game?
Yeah, I think the medical community, by and large, behaved very well, very responsibly. You get the Dr. Fauci's of the world who, as the crisis deepened, understood more and more how dangerous this was. I think that physicians, first do no harm, put your patient's interest first, did a really good job of making sure that that they were open, that it was safe to visit them. You wear a mask. When I went to my doctor, wear a mask, make sure the temperature's okay. You practice social distancing. You waited in your car. They did all the important things. The political system, I think there was a good argument to be made that the political system failed us. Our leadership wasn't straight with us. They put other interests in front of the patient's interests. It's heartbreaking to see the innocent pay for it, unfortunately, and hopefully we can do better the next time. I think that there's a huge amount of talk amongst the experts in the healthcare and financial medical communities that will point out how our current system has failed in so many ways, current health insurance system to protect a lot of people. I think that having a well-funded public health system and a well-funded health insurance system that covers everybody, not just the lucky few, is certainly a vast improvement over what we have right now. Heartbreaking, I agree.
So that would say, should the conservatives approve of Medicare for all? What should they do going forward?
Well, you'd think that good health care, not having people go bankrupt, everybody having access to affordable health insurance, be no question this would be bipartisan and nonpartisan. I hear from my own congressman about different claims that are extremely misleading, that it's more dangerous to believe than to disbelieve. I think it doesn't serve the constituents' healthcare exactly to their best degree. So here's the argument that I make for conservatives. It's also for liberals as well. There are 7 broad, what I call conservative principles that should appeal to every conservative. Let me briefly go through them and then I will explain a little bit. Medicare for all is cheaper to run. It will control costs. It will give you more competition. It will give you less government, or I should say, political interference. Because there's universal coverage, there should be universal contributions. It's great for business. And what happens when the insurance industry is vastly changed compared to what we have right now, it's creative destruction. Let's start with cheaper to run. It's 1 or 2% to run Medicare for all, based on what it is in Canada, what it is for our own current Medicare system. Our own current Medicare system is the basis for Medicare for all, but it needs supplementals and out-of-pocket costs and deductibles. Medicare for all is a vast improvement on that. So compared to 12%, 2% in administrative costs is a much improvement. And again, we're talking about 1 or 2% versus the 20% that the system takes out of the money put in. So that's a huge improvement, cheaper to run. Number 2, Medicare for all will control costs. It becomes what's called a monopsony. It's a monopoly of buying power. So it will help control costs. Now, I wouldn't worry too much if I'm a provider or a healthcare industry, because using Canada as an example, even though it's got an economy which is a fraction of ours, it still manages to make sure that all providers and healthcare suppliers are paid very well. Doctors, for example, are the highest paid professional group in Canada, and they have a fraction of the economy that we have under their single payer system. It's a lot more competitive. When you don't have an insurance company telling you which provider to see, which hospital to go to, now all of a sudden patients can choose any provider that they want. And you may not, as a provider, be competing on price, but you're competing on availability, affability, you're competing on service. Okay, wow, that's what liberal or conservative wouldn't like that. You get less political interference based on our experience with Medicare. You get talk from time to time about, well, let's cut Medicare benefits, but it's really the third rail of American politics. If you're a politician and you want to cut somebody's benefit, especially if you're cutting 320 million Americans' benefits, do that at your political life peril. Universal coverage means universal contributions. This is something that originally came from the very conservative Heritage Foundation. And conservatives should like this, based on their idea of personal responsibility. If you're going to benefit from a program, you should put contributions into it. That's a pretty safe thing. By the way, what that does is it creates one giant medical risk pool, and everybody's in it and paying their contributions based on their income, again, the most affordable way. And what it does is it changes the situation from what it is right now. Right now, you have a system that penalizes you if you get sick and punishes you for getting old. We don't want a system that penalizes you for getting sick or punishes you from getting old. Let me emphasize the following thing. If you're a business person, Medicare for all should be something that you definitely want and want now. Who in the right mind, whether it's a business person or even a state legislator, wants the burden of providing for your employees or your constituents health care on your shoulders. You would much prefer, because it's a lot cheaper, to pay a contribution based on your payroll into a system that benefits everybody. Because right now, what happens is that the larger corporations, they have a Medicare medical office where every year they look for the cheapest plan. What that means is that if you're an employee of a company, your plan may change, therefore your provider may change, your deductible will go up, your premium will go up. Everybody is hurt by that. If you have a system that covers everybody, another thing that's very good for business is the following. This is important. You have medical desert areas. You have areas in rural and urban areas where it's not a problem not having enough patients, it's not having enough paying customers. People who don't have insurance, or people who have insurance that can't afford to use it, don't go to the doctor. So there are vast areas of the state and the country, in cities as well, where you have no physicians, no hospitals, few drugstores. And the reason for that is you don't have paying customers. If you have Medicare for all, where everybody is covered, and nobody has to think twice about, can I afford that $50 copay? Can I afford that $85 for that monthly prescription? Then all of a sudden you have people who can actually go and get their care. The dollars flow, the businesses pick up. That's really good. If you're a business person, in addition, and you want to start your own business, no longer do you have the punitive healthcare costs that are based on some arbitrary policy that's a premium that's good for the insurance company. What you have is a contribution based on your payroll. So if you're an entrepreneur and you want to start a big business or a mom and pop business, it's much easier for you to do that under a Medicare for all, because you know pretty much that you're going to get a kind of a bargain based on what your payroll is. I think that's really good. Finally, if you're an employee, I know this is not really talking about business, but if you're an employee, you no longer have your health insurance tied to your job. You have a better job, you can take it, and because your health insurance is completely divorced from any job that you may have. That's really good for an economy, and especially then we have that kind of a system. What we have right now is a level playing field. So now, not only is there better competitiveness in businesses locally, regionally, and nationally, it's better for American businesses under a single payer system to compete on a global level. Finally, people say, well, what happens to the insurance companies? It's a big industry. It employs 1 million people. What happens to them? Well, conservative economists call the natural demise of businesses that are no longer useful, like the horse and buggy whip manufacturer. When they go out of business, it's called creative destruction. And rather than spending money into a business which is no longer useful, say a very expensive middleman in healthcare that takes away your insurance dollars and spends them on something that is not your healthcare, when that business goes away and is replaced by something else, that's called creative destruction. Now, let me just add briefly, well, what about all those employees? What's going to happen to them? With the $500 billion that we save every year, that's so much money that we can take tens of billions of dollars each year for the first 2 or 3 years once that system goes away, and make sure that those tens of billions of dollars a year go towards giving a safe landing to employees of that industry that may lose their jobs. You find them a different job, you train them, or if you're old enough, you just give them a good pension. There's that much money, and you say, thanks for your service. You're 65. You're now entitled to retire. So those are 7 conservative reasons why everybody, including liberals, should go for a single payer. It's a long answer, but if you have any questions, let me know.
That's quite all right, because you brought up a very interesting point. So I know for a fact, we all know for a fact, that there's certain things that needs to be done as far as testing goes, for rectal cancer, for prostate cancer, for breast cancer. And those needs are not being done because people have to make the decision on, do I go for this test? And if I go for this test and I'm found to have these issues, how can I pay for it? So people don't do that in a timely manner. And not doing that in a timely manner costs us more dollars, because at the point when they actually have to be hospitalized because they didn't get the early response, it costs them twice as much. Whereas we do a pound of prevention, and we have a minuscule amount of people who are actually beyond that. I don't understand the logic behind that. Do you think that if we had more competition, would that increase? If people were more knowledgeable about getting early access, if the dollars were, if they didn't have to pay so much as far as if healthcare, they would get these tests done early. Does that play a part in our bang for our buck, so to speak?
Absolutely. As I said before, just for people who have no insurance, if you gave them health insurance, 68,000 people a year would live instead of dying. 68,000. That's a huge number. You can argue about the number, but the fact is that it is in the tens of thousands. Under a Medicare for all system with a single payer where there's no copay, there's no money out of your pocket when you get health care, even though some people may want to characterize that as free, again, that makes it affordable for everyone. And when you get enough advertising for the patient, not for the product that they're supposed to buy, when you make the product they're supposed to buy preventative health, and you have public service announcements to that effect, absolutely you can save huge amounts of money. As we talked about before, when that ounce of prevention prevents a pound of cure. It's very expensive when somebody has had that colonic polyp, rather than taking out in a colonoscopy for pennies on the dollar compared to what it costs to give somebody surgery to remove that or give them chemotherapy when that tumor has spread. The amount of money that you save is enormous. And so there's all kinds of fiscal responsibility, the rewards to a single payer system compared to our present system. Again, you have to make it about putting the interest of the patient first, not the interest of the various industries. The industries are important, and I'm not saying that they need to disappear. And I will say this about the health insurance industry. They know how to pick and choose various markets. They have no hesitation whatsoever of saying, Southwest Virginia, we're not going to make enough money. We're not going to go there. We're going to diversify. We're going to go somewhere else and spend our money. Was a vertical integration that they can do. They can invest their dollars elsewhere. It's galling to see the health insurance industry and the pharmaceutical industries taking your dollars and mine, and instead of spending them on our healthcare, spending them on massive PR or lobbying efforts to talk directly to the legislators to vote against our best interests as patients. They're not using their dollars. They're using your dollars and mine to do that. And hey, politicians, why aren't you more interested in cutting those 68,000 deaths down to zero? Why aren't you interested in those 500,000 medical bankruptcies and cutting that down to zero? Why aren't you more interested in those 80 million people who either have no insurance or can't afford to use their insurance that they have? Why aren't you more interested in putting that down to zero than protecting the interest of the various industries? It's something that I don't particularly like seeing in my country in 2021, when we're the wealthiest country the world has ever seen.
So you just brought up a very important point that leads us into my next question is, you have made me believe we actually need less government in Medicare. And the less government we have in Medicare seems like it would be great for business. It may not be $1 million at one swoop, but they will still get a return on their investment in the long run. And it'll probably open up more jobs because as more people survive, they become more gainfully employed in other venues and things. So
Ken, I don't know how to put it less government, because one of the things that the opponents use is they want to get government out of healthcare. And it's the person on Medicare that says, keep the government out of my healthcare when they have Medicare. What this is, and I should emphasize, is that Medicare for all is not government run. I hear that all the time from my congressman. It's government run healthcare. It's not. What we have right now is a system that's run by and for the health insurance industry. Medicare for all is government funded but it's privately delivered healthcare. So we use the same system that we have right now, which is a private system to deliver healthcare, but that should grow and not be hindered. What we need is less political interference, but we need a government funded healthcare where the government then sits back and says, okay, we've set up the system. We're not interfere with how it's run the way doctors every day have their health, their medical practices interfered with, because we got to go and ask the big guy with the green eye shades at the health insurance industry company and say, can I order this for my patient? Can I do that for my patient? And frequently they say no because it interferes with their business model. So yes, less government interference is exactly right, but we do that with a government-run program that delivers privately delivered healthcare. Sorry.
Then I'm glad I brought that question up because that clarifies things a little bit more. So I didn't know that until now, and I'm pretty sure most of our viewers didn't know that either. So that I'm glad I phrased it that way. And I love getting educated. It's the epitome of moving forward out of the Neanderthal age. So. Can we build on Obamacare, so to speak?
No, and this is where the word compromise comes in. And, I like to think that I'm a pretty political moderate and give a little bit here, give a little bit there. Why I'm so strong for Medicare for all is the following. Because I think only it will make healthcare truly universal and truly affordable. We can build on Obamacare, but we could use Obamacare. We would keep all the bad features of the current system. The control that the health insurance industry has, the co-pays, which are out of sight with Obamacare. When you're poor, even if the government pays your $500 a month premium, who can afford a $6,000 deductible? It's absurd. So when it comes to using Obamacare or a public option, basically what you're doing, even though it sounds nice, it's a compromise. And what's going to happen with a compromise, one of two things. Either going to spend way more money than we already put into healthcare, and like $3.5 to $4 trillion isn't enough. Think about spending another $500 billion a year into healthcare. What it's $10,000 per family. Who wants to spend that kind of money? Or enough people don't come off the list of the 80 million people or so who aren't covered. So you're going to leave some people uncovered, and you're going to spend more. And that's why Obamacare won't work. That's why using a public option won't work. It will be a compromise, and a compromise that leaves people to die, people to go bankrupt, people who can't afford their health insurance. Who wants to make that kind of a compromise? Naming the politician who does. And they become a target politically.
I have a question that I know there are a lot of people who have the same question that I do. Every year you can change, you can choose to select how your health care is provided. And I got to tell you something. My second major in college was psychology, but I've always had a business sense. Most of the work that I've done over the years has been in retail. Even though I've worked for the government, I was an ex-firefighter, so forth and so on. When people ask me questions about how can you avoid getting infectious diseases, I did that at the Washington Hospital Center, cleaning up infectious disease rooms after the patient was either healed out or died. I had to go and disinfect the room, so I understand all that. But when I look at trying to choose or navigate through all of the people who are giving me these options on healthcare, it's like reading a tax return. I have no clue about who is trying to get my money and provide me the less bang for my buck. And it's so frightening that you almost have to hire a specialist to hire another specialist to dive in to find out what's special than the healthcare products that they're offering that would be special to me as an individual. I'm pretty sure that everybody else goes through the same thing. Will having a decent Medicare for all change all of that?
It will eliminate that hassle. I go through the same hassle as well. And choosing which plan to use for the very first time took hours and hours. And then it's a pig in a poke. The information is really opaque. There's a lot of information there. It's overwhelming. I have a hard time doing it. I don't know most people who don't have a hard time doing it. I went to an insurance broker, had a hard time explaining it as well. That one-size-fit-all program begins to look pretty good after you spent 4 or 5 bleary-eyed hours trying to figure out which plan is best for you. It's an impossible choice. And in the end, again, the house always wins. And if you want to have a system where the house always wins and you and your kids and your parents lose in a health insurance system, vote for the guy who says he doesn't want to change it. Great question.
Well, okay. Because, they had this open healthcare thing that started, I think, in November of last year, and it ended in December. And I couldn't decide. So I just said, you know what? I'm just going to stick with what I already got and just let it float. And then all of a sudden in January this year, it was open again. I'm going, wait a minute, you told me that I had to make a decision by December. How does it get to be open now? And then people are advertising. I see it on TV all the time. And you must make a decision now, and then blah. And they even got a quarterback and Joe Namath advertising for it. I go, what? Where's his fur coat? I thought he was a football player. What is he doing in healthcare?
Well, that's for Medicare Advantage, which is basically a private run system. It's like an HMO. If you loved your HMO, you may love your Medicare Advantage. The Medicare Advantage is clearly set up to the advantage of the insurance company, in my opinion. I know that most of the experts who are pushing for Medicare for all want a traditional, want their plan based on traditional Medicare, not Medicare Advantage, which is just a perpetuation of the current system that puts the health insurance industry in charge of your healthcare dollar, again, which I think is inimical to the best interests of your interests as a patient.
So, can I call you Dr. J?
Absolutely.
I want to thank you for your well-informed lecture on why Medicare for All is the choice that we should be going for. I'm sure my viewers have learned just like I have, and I also know that we have a dire need to have you back on the show again, so that there are other things about healthcare we can talk about. So it's been a pleasure. Thank you for joining us today. This is Inside Scoop. My name is Ken McMillon. Our guest that has just left us is Jay Brock, a doctor, and I hope you've enjoyed the show.